in a country where over 2.2 million children remain completely unvaccinated and only 35.6% of children aged 12 to 23 months receive full immunization. Nigeria's struggle with vaccines access is far from over. Despite efforts by health authorities, regional disparities, weak infrastructure, and community distrust continue to leave millions of children behind. Against the backdrop, the African Vaccination Week returning this April brings renewed attention to the urgent need for the equitable, consistent, and nationwide immunization efforts. Lilian Ogazi reports.
With over 8 million births each year, immunization remains one of Nigeria's most critical public health tools. Yet, the challenge is staggering. Nigeria accounts for 2.2 million of the 4.4 million zero-dose children in West Africa, the highest number globally. According to recent data, just 35.6% of Nigerian children aged 12 to 23 months are fully vaccinated. This national average hides a deeper issue, sharp disparity in coverage across regions. But amid the concerning numbers, there are bright spots. The World Health Organization reports that Nasarawa State is the only state among Nigeria's 36 and the FCT that has consistently implemented integrated supplemental immunization as scheduled.
We have, yes, challenges, and this is something we also need to recognize and look for solutions, because problems, just reminding of problems makes no sense if we don't look how to overcome them. So we have to remember that 1/3 of the infants under 1 year old do not have access to immunization, and this is what we call as the zero-dose children. Those children are the most left behind for many reasons. One of the reasons is vaccine hesitancy, the lack of access to services. In some regions we have this huge challenge of insecurity, some logistics hurdles to reach remote communities, and among others.
As African Vaccination Week 2025 unfolds from April 24th to 30th, the theme, Immunization for All is Humanly Possible, underscores a shared responsibility to ensure that geography or circumstance doesn't undermine access to life-saving vaccines.
We have identified 540,000 settlements in the priority areas and 926,000 under 5 children that were enumerated and tracked. And as a test of this, during the last polio campaign, 92% of these children were again identified and vaccinated because we knew who they were. The vaccination teams were armed with the information on who they are, where they live, and 92% of them are reached. We are deploying the same strategy to extend to other health campaigns and eventually even to our routine immunization outreaches, so that we start to routinize that going forward. Our vision is to leave no child unimmunized, and of course that means we have to very quickly tackle the issue of zero-dose children in some of these priorities. And the theme for the 2025 African Vaccination Week, Immunization for All is Humanly Possible, aligns very well with our own vision for immunization, and certainly the President's plan for all Nigerians to leave no one behind. Working with our partners as well, we have scaled up last mile vaccine delivery to about 7 states, I believe now, and the idea is to equip them to deliver vaccines to the last mile. We're working with the state and security agencies to ensure immunization and other PHE services reach our people in hard-to-reach areas.
Nigeria's vaccination journey is a tale of contrast of significant gaps, yet undeniable potential. As the country marks African Vaccination Week, stakeholders say the message is clear. With coordination, commitment, and community trust, universal immunization is not just a goal. It's within reach. Lilian Ogazi, Trust TV News, Abuja.